So sleep paralysis is something that is actually very common. Many people have it. I've had it myself. And what happens is when you're in that REM stage of sleep, your brain is very active. You're dreaming the most during that stage. Your mind, your eyes are moving. There's a lot that's going on. It's like fireworks going on in your brain. Now, what happens in the rest of your body, and this is an evolutionary function, is that your body has muscle atonia, meaning your muscles are basically turned off. They can't work. So your brain is active, your muscles can't work. Now, for what happens in sleep paralysis is that some patients, and we'll notice this early in the morning because you're having more REM sleep then, will wake up in the middle of REM sleep. So I know myself, I woke up once in the middle of REM sleep and I couldn't move my muscles. And it was very scary. And it's scary for anyone who has it because your mind is very active, your eyes are active, but nothing else is moving. So you have to give yourself a little while. You'll come out of the REM state, your muscles awaken, and it's fine. It's a totally normal thing to have. Now, it can be indicative sometimes of other sleep disorders. So we'll see it a lot in narcolepsy. So some patients will report that they have sleep paralysis. If we see sleep paralysis alone and nothing else, we don't really think all that much of it. But if we see other symptoms, then it might be a red flag for something else that's going on. So in REM Behavior Disorder, RBD, it's a newer diagnosis. I'd say probably about the past 10 to 15 years, we're really recognizing it more and more. Patients will come to our practice and they'll say, I'm waking up in the morning and I have bruises on my arms, my fists are bloody, or they'll say, my house was a mess, I found things all over the place. Generally, that can be sleepwalking, but sleepwalking tends to not be as violent, and that's earlier in the night when you're in the deeper stages of sleep. In RBD, it tends to be a bit more violent, a bit more aggressive. So when you're in REM sleep, your muscles are supposed to have atonia and no function for them. But for some patients, their muscles don't turn off. So if they're having a nightmare or a very vivid dream, they'll actually act out essentially their dream in their sleep during REM sleep. So that's why we'll see patients come in with bruises, their bed's a mess, they might fall out of bed, things like that. So it can be, for some patients, a very violent problem that we actually need to treat aggressively. Yeah, there are some that are REM behavior disorder we'll see for some court documented cases, and they really need to have a thorough evaluation with a sleep specialist. You can't just say, oh, it was while I was sleeping. There's confusional arousal, so there are states in deeper sleep that can happen where people will go and they'll disappear, or they'll take on some other persona, or commit some crime, but it's all when they're in a very deep stage of sleep. So you really need to have a very thorough evaluation. But yes, there's a line of work of people who work with people who've been charged for crimes and will actually do sleep disorder analyses with them.